have some time for dialogue, so let's have all the presenters up. Unfortunately, Bill had to leave. We've got quite a lot. I promised a discussion about continuing the theme of self-reliance and self-determination and sovereignty. What I didn't appreciate until hearing this is the giant long view that all of you brought, the extent to which you've painted a portrait of a very fluid economy and set of living conditions, which certainly marked by entrenched inequity and deep oppression, is also not destined to be that way. I think all of you have provided examples of the origin stories of your work and how it actually remains as quite unfinished work. We've got questions up here already. Let's start there, and we'll see where this goes.
Thank you. I'm Winston Wong. I'm a member of the Roundtable on Health Equity, and I'm also a physician with Kaiser Permanente. It was a great panel. Thank you. The passion was very evident, especially Ms. Livingston. I really appreciated your remarks. We started with the first presentation around resilience, and I think the last few presentations were about empowerment. And I thought the key point here was around investment in youth and thinking about resilience and empowerment. Do you have any further kinds of insights with regards to how we really invest in the youth in rural communities, in Indian communities, and how we think about that in a sustainable fashion?
First of all, for the youth, okay, it's on. Thanks. For the youth, thank you for the question. And I appreciate your comments. And regarding the youth, it's just like going to a different country, right? You learn their language, you learn their food, you learn their style of doing things, and the same with our youth. We have to get down to their level, no matter what. And I try to get on social media. I try to talk with the youth and see what their interests are and see how that they do things. And for us, we really invest in the youth and allow them to take a role in what they're best at. And we know with the young people now is say, can you get on social media, Instagram or Twitter, can you tweet this? And they're on it right away. To tell the older generation, they're like, can you show me how, to work this? And so the youth, when you give them that purpose and say, hey, we're in it as a team, and especially coming from the Navajo Nation, like, we are very interdependent. And so bringing that concept and say, hey, as a team, we can move forward. As a team, we're going to, build, this vision. As a team, we're going to move forward, to create, this goal. And so allowing them to participate in however way. You saw through my presentation, some of them did painting, some of them, did Zumba. If they can move their arms or their legs, giving them a purpose in very small ways is very crucial. And they recognize that you come to them and say, hey, how are you doing? And you really get down to their level and have that conversation and have that one-on-one relationship and letting them know that you care, that you're not just there, you're not going to leave, you're not going to, go into a different community or it's not according to a grant objective and also not limited to the funds that you do have for maybe 1 or 2 years, but they know that you're going to be there. And so those are just some of the things, that we've encountered and allowing them to be a part of it. My colleague said also not only the youth, but also the young mothers that are continuously on social media. The young moms that they're always on Facebook and they know everything that's going on. They tweet, about what kind of formula that they're using, they're tweeting about their baby napping. Those are also the key areas, the key people that you want to reach out to because they have a lot of voice and they can spread the message and be a part of the purpose.
Well, I wanted to add too that with our youth, our vice president is fairly young and he's undocumented. He finished his 4 years of biology and now he's going into nursing. And so he is a model for the rest of the kids. And out of all of the things that we do, we try to present, as she has said, we try to present different things that they can acclimate to. For example, we have a theater group now, and they presented at the Capitol in Tallahassee this past session and did a thing on immigration, which was very powerful. And so the young people can express themselves through that acting group. Then we have the mariposas, which are dancers, but they also go out into the community and they share their culture. And they go to different places, which not only are they sharing their culture, but they're learning from where they go. If they go to a women's meeting, if they go to a church, they're out of their community and they're seeing what else is out there for them. We send our kids to other camps. Encampment is one of the places where we have sent our kids to, where they learn more about social justice, because our community, we can do so much, but we want them out of our community so they can see more. And out of that, then they come back. Immigration has been a terrible thing for our kids because they're right now not sure where things are going. And so we've had to develop other ways for them to express themselves. So we've had counseling for them so that they are able to share their feelings. But also, apart from that, is going to Tallahassee with all of the kids every year for the last 30-something years. Those kids are now, they know now, they can go, and because some of those legislatures have seen their faces and have heard their stories, they've made good decisions. And that's great. So kids are very important because they're our future. And if we don't share with them and if we don't expose them to the wider world, they're not going to go there.
Mm-hmm. Of course, that was one of the themes in your comments, Brian, is the need to actually give youth a reason to stay and to feel like they have a part in the place that they're building. Paula.
Thanks. Hi, I'm Paula Lance from the University of Michigan. I want to thank you for being here with us today and also for your ongoing tireless work to help build prosperity in rural communities. And keeping on the theme of youth, I've been concerned about an increasing trend in public policy and financing of public education, and that is the move to the 4-day school week. A number of states are seeing an increasing number in schools that have moved to that, primarily in western mountain states, but it's spreading. The Brookings Institution has a new report that suggests this is spreading very quickly. Pressures, obviously, in state budgets. It's not clear, people don't agree as to whether or not it's saving school districts money, but people do agree that it potentially could be hurting youth in a couple of ways. One, it's one less day a week for getting breakfast and lunch at school. So there's food access issues. And then also the pressures on families where somebody's working on that Friday when they're not having schools, it's creating costs to families. So I just wondered if, this is on any of your radar and if you have any reactions to, again, what I see as an increasing disturbing trend in public education.
So the only extent that I've looked at it within my research is in our focus groups and the discussion about child care costs and the inhibitor it is for some individuals to go out and work. So I can definitely appreciate that as a challenge. But I haven't studied it any more than that as far as how it correlates with any sort of economic growth.
Thank you.
Chris.
Good afternoon. My name is Chris Cable. I'm with the Kresge Foundation. I serve on the Health Equity Roundtable. I know the roundtable actually has a much longer name, but I can't get the name exactly right. Thank you very much for being here. Thank you for sharing your experiences. I'm actually a little bit bummed that Bill Bynum wasn't able to stay because we actually have a $3 million PRI active with Hope Credit Union to expand the work that they're doing. Kresge, even though our focus is on cities, it's not on rural areas, we certainly understand the connection between wealth building, between economic opportunity and health. And I was wondering, we've heard some inspiring examples, and yet it's not enough, right? Because in a lot of communities, there just aren't enough Hope Credit Unions to go around. There just aren't enough First Nations Development Institutes to go around. And there are a lot of players in the financial industry that view their work not through a lens of building wealth, but from extracting resources from low-income communities of color. I believe actually here in the state of Alabama, it's actually legal for payday loans or car title loan shops to charge more than 400% a year interest. There are states that have essentially privatized sections of their criminal justice system so that a $75 parking ticket can easily compound into a $500 set of interest and late fees. And I was wondering, in addition to sort of building opportunities for more access to capital, access to the mainstream of the economy, if there have been complements to also limit the bad actors, those who view their work more from an extractive lens and extracting wealth from communities that can least afford it.
You know, I haven't studied that specifically. When we measure the factors that help with economic growth, we're somewhat hostage to the data that's available. And I think what you're describing, you know, outside of a lot of the traditional banking systems, a lot of that data isn't readily available where we can correlate it on a broad spectrum. But the PRI piece that you described, I think, is interesting because there's a group that started at the University of Denver, and now I think they're at Colorado State, who works a lot within this space, and I think it's very much a growing trend. I think it's gaining a lot of traction, so I think you see a lot of investor empowerment that can help some of these areas where we haven't seen it in the past.
Other comments on that theme of?
Well, I mean, even for us, we have no data from Navajo regarding that. We know that, you know, there's the predatory lending and those different issues that still need to be addressed. We know that our work is just one aspect, and we hope, you know, from the revenue, and this year working on the compliance and enforcement issues, that we're empowering also the tax commission, and some of that funding will be going back to our Navajo Nation, which is causing a lot of conversation too, that our grassroots people is now funding the largest tribe in the nation. What's going on here? And I know that our tribal government has a AAA rating as well. And so we hope that, you know, these conversations will be able to connect to one another, and that tax will also allow the chapters to employ our own Navajo people, whether that's for Zumba or whether, you know, that's for workshops or whatever it is, that we'll be able to create those sorts of outlets to invest in the community. But for now, this is just one aspect, you know, like you said, that needs to address other issues.
George.
I'm George Flores. I'm with the Roundtable on Population Health and with the California Endowment. Thank you again for your presentation. So addressing the issue of prosperity, what comes to mind in my mindset is the biggest prosperity engine that we have in America today, and that is technology. And I'm wondering what the impact on rural areas is and could be. Is there a greater potential for technology in rural areas, considering distance learning, considering use of technological tools for health education and moving population health improvements, applications for people distance telecommuting, lifestyle advantages of living in rural areas but working for companies, you know, at a distance with internet connection and so forth. I'm just wondering if you could comment on whether there's any effort to harness that. Is there any conversation going on with people from the tech industry, and in what ways might you be using technology to perhaps accelerate prosperity in rural areas?
So I'll start, and I think I touched on this a little bit in my presentation, but one trend we're seeing right now in Colorado is this real push by the legislature to ensure broadband access in rural areas. And we know that that's the most expensive mile to complete, just like as it was for roads and for electricity, because you've got very few users across a vast distance of land. But we are seeing subsidies go into that and incentives for companies to finish that last mile. And that's not only to connect households, but importantly to connect schools. And I think that does provide a big opportunity for location-neutral businesses. So that could be someone, a sole proprietor who's doing software programming out of their house, or it could be someone who's working for a company remotely. So that's an opportunity, and then people can choose the place, and they don't have to choose just where the office is. They can choose the place that they want to live and work. And we've even seen a trend where some companies are not recruiting people to a location, but they're finding people in a place and they're building a remote office in that place. So maybe, you know, I'm up in Boulder, but maybe a recruiting firm finds 4 people down in the Colorado Springs area. They can put up a mobile office pretty quickly at a remote location and aggregate the people around that location because of technology. But still, I think rural areas still have inhibitors that are just going to be inherent to their communities. So if I'm a manufacturer, for instance, we used to have this bus manufacturer in eastern Colorado. The bus manufacturing plant closed, and it's a rural area that's far from the urban centers. And so who do you recruit to take over that place? It's hard to find a comparable firm because if you find someone who's interested in the place, you still need your engineers and your skilled laborers to come in and manufacture something. And it's a bigger risk for the firm, right? So you can choose that location and find people that want to be there in that small community out on the Eastern Plains, or you can go to the urban area where if you lose your key engineer or your key machinist, there's probably 1 or 2 or 3 people right behind them that you can recruit to work for your company. So I think if you're talking about technology and scaling businesses, you're still going to run into the traditional challenges of recruiting a company to come to rural areas. So oftentimes in economic development, in urban areas, we see a strategy to relocate firms. In rural areas, it's more limited to retain and grow. Does that help? Does that answer your question a little bit?
We definitely have a big demand for technology, and for us, though, we have other issues that we need to address. We still have communities that don't have running water, and so we don't have electricity in some areas too. But we do need that technology, solar energy. We need, some investments there, and I definitely know that the young people, they love technology. And across Navajo, we normally don't have LTE or 3G. We have extended 1X. And so sometimes, we're having to ignore our emails in this fast-paced, world now. We can't even send an email, in a few seconds. It takes a while to load up, and I see there's a great demand. And so I know one of my friends says, our Wi-Fi hotspots are our elders. We have to tap into their knowledge. So that's it for now.
Margarita, any final thoughts on
And
that?
I just wanted to say that I'm past that technology piece, but what we have found is a young man that came to us that wanted to work with us, and he started the YES program, which is the Youth Entrepreneurial Students. And of course, he's very, very much a tech. So we've made room for a small office for him to have as much tech as he can bring together to teach our people and teach our kids mostly, because like I said, the older ones, our older people don't really seem to care about it. It's like me, I can email and that's about it. But I know that the kids really need it because this is part of the new regime coming up. And so we try to make room for it. But we don't have enough of all of that we need, but as Denise said, there's other things that we are really concerned about more so than that.
I think we have time for just one last question. Kathy?
Hi, Kathy Bozzi, member of the Population Health Roundtable and the Michigan Health Improvement Alliance, also focused on rural communities. Appreciate all of you being here, and the theme that's coming through the day so often is the links between health and the economy and the intertwinement of that. I was reflecting on the messages coming from this group so often bringing empowerment and hope to your communities, and the earlier session today talking about diseases of despair, and wondering what you've seen in terms of the advancements you're making in the call and the raising up of people around their capacity, self-empowerment, and their reasons for hope, and those diseases of despair.
I don't like that word diseases of despair. But I think that in our particular community, we have had much hope because there's always tomorrow. And we have had to find ways to be sure that we don't lose hope. Because if we lose it, we're dead. And so for us, it has been a constant pulling toward the light. And I think that, even as poor, and I said this the other day, even as poor people, we all have something to give. We all have something to share. Sometimes we have to, shake each other to remind us of that, but we do have it. And when we bring that out, it gives us that hope that other people may not have. We can do something. We have arms and legs and mind and eyes. We can do something. God gave us the tools. We're not without those tools. We just have to put them together and put them to use. So for us, I don't know. I think when you get to that despair place, then where do you go from there? And for us, not having had anything at all, not having money, not having anybody to say how to do it or how to not do it, we were able to stay together as a community. And I think that is probably the thing, is that maybe today people are losing community. People are losing that being together, being, serving each other, helping each other. We're each one in our own little house with our own little picket fence, and I think that has been disastrous to America. We need to stay together, and that brings us hope. And I don't know if I said anything you wanted to hear, but I'm feeling it.
I think for us, there's always that challenge of having our people in just dying situations and them dying before you and having that hope to go forward. And the impetus here is my mother. She's been an example for us all because she reversed her diabetes. And for the people in the community and the tribal council to see her and to see that beauty and that health in her has really opened our eyes. And I had challenge a system when I was doing my graduate internship. I had an Ivy League person telling my people, and she was also Navajo, telling them that diabetes is not reversible. And I had to challenge them, and I said, why are you telling my people that this is not reversible? It's reversible. And we know that studies say that. And I had gone to the president of our Navajo Nation and said, we have to change the message. We have a group of people that are not doing what they need to do to improve their health. They're compromising, and they're saying, why should I even improve when I can't reverse it? And we had this message go out across the Navajo Nation saying that diabetes is reversible. You see it on billboards now, finally. But there's always the challenge also that there's an addiction. We know that our young people, and also we're finding out that the barriers are now the parents, that the parents are now buying the food when the young people are learning in the schools how to eat healthily, how to exercise and pursue healthy lifestyles. When they go home, all they have is maybe ramen noodles or processed foods, and the parents are saying this is what we can afford and this is all you're going to eat, when they want to have fresh fruits and vegetables. And there's always that challenge, and we do have that opposition of people saying, don't touch my junk food, and there's an addiction there. And so whether it's having hope, whether it's dealing with the disease, the biggest thing right now is that we as Indigenous people, that we're returning back to where we came from, and we're returning back to how our ancestors were raised, and also how our grandparents farmed and how they had their own livestock. That's going to be the future, and that's going to be our hope. And also us agreeing that at this point, that together we can create that change, because our currency was not money, was not cash. Our currency was always produce. It was food. It was exchange of goods. And so our mindset of prosperity as well is also different, that we're not only prosperous in having economic development, but also spiritual health, cultural health, resiliency, and all these different areas of well-being. So there's all these different factors of really, going forward and saying, hey, are we, going to have hope here, and we have people dying, how do we balance these? And it's such a challenge for all of us, because when you do see someone dying, you get tired of it. You want to just at that point, and I've had people come and say, Denisa, why don't you introduce bills and just ban junk food? Because we see this addiction, we see the sickness and death happen before us every day.
That's a terrific point to end on. You know, even in these most desperate circumstances, I think all of your work demonstrates that there really is the potential of the long haul to restructure laws and economic incentives and the major drivers that really are about placemaking. So thank our panelists, and we have to remain on schedule here, we want to keep to an exact break here, so come back at 3:15 sharply. I don't know what that noise is, but we'll investigate the noise. Thank you all.